Welcome, everyone. I'm Kim Brown. I'm with the Rural Institute for Inclusive Communities, Transition and Employment Projects, and Teresa Baldry and I will be your moderators for today. Live captioning is available for the session, and to access the captions, open the captioning link that I've posted on the slide in front of you, and it's also posted in the chat box. You will want to open that in a new browser window, and then you can shrink the box and adjust it to where you'd like. And just so you know, it's Tiffany, our presenter, who you're seeing on the screen right now, and not myself. I don't have my webcam on due to bandwidth issues, but we will introduce Tiffany in just a few moments. Also, if you're using the captions and you have that captioning window open, you can opt to show or hide the caption header and chat boxes, which will make that screen a little bit more open for you if you hide those boxes. Today's webinar is sponsored by the Montana Deafblind Project, which is funded in whole or in part by the U.S. Department of Education Office of Special Education Programs, or OSEP, and through a contract with Children's Special Health Services at the Montana Department of Public Health and Human Services. The statements shared in today's presentation do not necessarily reflect the opinions of the sponsoring departments. All attendees are currently muted. This helps to cut down on the background noise so that everyone can hear our presenter. If you do want to ask our presenter a question or make a comment, please type your question or comment into the chat box. And please note that only you, the moderators, and the presenter will be able to see what you've typed into the chat box. If you're not seeing the chat box right now, go to the upper right-hand corner of your screen, and there is an orange box with a white arrow inside of it. If you click on that, it should open the GoToWebinar dashboard for you, and one of the items on that dashboard is the chat or the questions box. For those of you who requested Montana Office of Public Instruction renewal units when you registered, those will be emailed to you after the webinar, and that does take up to a couple of weeks to get those out. Please note that you do have to pre-register and request the OPI credit in order to receive it. There's also a certificate of attendance that is available. The link for that will be sent to you in the follow-up email that is sent out from GoToWebinar tomorrow. Today's session is being recorded for the Montana Deafblind Project and Transition and Employment Project's resource libraries. By participating in the webinar, you grant permission for any chats and/or questions you submit through the webinar platform to be recorded. The videos for today's webinar, will be posted to the training archives pages, and I will put the URLs or website addresses for those pages in the chat box in just a bit. The handouts for today's session, including the slide deck, are available already for download on both of those websites, and they're also available in the handouts area of your GoToWebinar dashboard. So if you'd like to download those today during the presentation, you can do that right from the handouts section on your screen. After today's webinar, as soon as it ends, a survey will pop up, and we do hope that you'll take the time to complete those, I think, 6 questions. It's really short, but we do use the information that you provide to us in order to improve the webinars that we offer and also in order to plan future webinars. So again, please take the time to fill that out. If you don't have time after today's webinar, the link to that survey can also be provided tomorrow. So let me know if you are not able to fill it out today, and I can get that link to you. And with that, I would like to turn over the presentation to Teresa Baldry for a quick description of the Montana Deafblind Project. Teresa?
Thank you, Kim, and welcome all. My name again is Teresa Baldry, and I am with the project coordinator at the Montana Deafblind Project. We are a source of specialized information, technical assistance, and resources focused on improving education, inclusion, as well as college and career readiness for individuals with combined hearing and vision loss between the ages of birth and 21. We are located at the Rural Institute for Inclusive Communities at the University of Montana. This is an image of our website. Currently, we have 3 staff, all who work part-time. On the slide, you can see there's multiple ways to connect with us: email, phone, fax, as well as a contact form right on the website. We also have a Facebook group. You're welcome to join and learn more about the website. We have a variety of areas of focus listed, transition being one of those and relevant for today. So what is deafblindness? The term deafblindness is often misleading. It implies complete absence of vision or hearing. In reality, only about 6% of the children who are deafblind are without any sight or hearing. While most individuals have some usable vision and or hearing, no two children with deafblindness are alike. The loss of vision and hearing, even minor losses, can greatly impact development and learning. Children who are deafblind must be taught using strategies that are responsive to their individual sensory, cognitive, and physical skills. Today's focus moves us to transition. And with that, I will introduce today's presenter, Tiffany Costa. So thank you, Tiffany, for being with us today. Tiffany has worked for Montana State University Billings Work Incentives Planning and Assistance Program as the project director / community work incentives coordinator, CWIC, since August of 2013. She earned both her master's in health administration in 2011 and bachelor's in counseling and human services in 2001 from Montana State University Billings. She received her CWIC certification from Virginia Commonwealth University in 2008. Montana State University Billings Work Incentive Planning and Assistance Program, WIPA, receives funding from Social Security. They provide benefits counseling to Social Security disability beneficiaries who are interested in work and individuals who are already working. The goal of the WIPA program is to assist Social Security beneficiaries with disabilities to make informed choices about work and to support working beneficiaries by helping them make a successful transition to self-sufficiency. MSU Billings WIPA services are provided statewide in Montana and Idaho and are free of charge. And with that, I will turn the presentation over to Tiffany.
Thank you, Teresa. All right. Hello, everybody. Today I'm going to talk to you about our program. It's called Work Incentives Planning and Assistance Program. I'm going to speak about SSI and youth who are going to work. I'm a community incentives coordinator, and Teresa already gave an introduction, so we'll go ahead and move to the next slide here. Okay. So currently, Social Security funds WIPA projects, Work Incentives Planning and Assistance projects. There are 83 projects nationally in the U.S. These services are free to beneficiaries. We start working with folks as early as the age of 14 years of age, all the way to full age retirement. So we are a statewide project covering Montana and Idaho. And so I've provided our contact information here. A little bit about our referral process. It's changed somewhat over the years. And so I want to get that information out to you. To be eligible for our services, a person needs to be receiving some form of Social Security benefits, that being SSI, Supplemental Security Income, SSDI, which is Social Security Disability Insurance, and or childhood disability benefits. Some folks under the age of 18 might be receiving dependent benefits, which is different than receiving SSI. So individuals receiving Social Security benefits, and the goal is to return to work. So if they are currently job searching, employed, you know, if they're transition age youth, we start working with them at any point in that continuum of we're thinking about going to work. So we start working with youth at age 14, and help them navigate that, explain to them, you know, what will happen to their state benefits, what happens to their Social Security check if they go to work. So we provide comprehensive counseling so they know what's going to happen when they do go to work. So once they, if they meet the criteria and they're eligible, we do ask folks to call the Ticket to Work helpline, and their phone number is here on the screen. Those folks will determine eligibility, and what they do is they send us an email, an encrypted email to us for all of our new referrals for Montana and Idaho. I have a coworker, her name is Jay, she's my intake specialist. She reaches out to all those new referrals to gather the paperwork needed for us to provide benefits counseling services to folks. And once a person's enrolled in our program, they stay with us for a long time. I call them our forever clients. As they have job changes, receive letters from Social Security, we're there to help them. We're just a phone call away. Okay. So I'm not able to move to the next slide here. I don't know what I did wrong. My PowerPoint. Let's see here. It's not.
Tiffany, there should be a plus sign on the sort of right-hand lower area of your screen that allows you to advance.
Oh, let's see here. Just get this way. So what is a community work incentive coordinator? We provide work incentives, planning and assistance services to Social Security beneficiaries. We help beneficiaries and their families determine eligibility for state and federal work incentive programs. We partner with community agencies. So I do a lot of my outreach is, you know, reaching out to the local Social Security offices, folk rehab offices, job service offices, to let them know we're here to help folks and make sure that we're getting the referrals we need statewide. We also work with the PABS program, the Protection and Advocacy. We collaborate with them as well. And we provide health care planning and counseling, because that one is the biggest thing for folks. You know, when you're trying to return to work, it's a huge barrier for a person to say, hey, I want to go to work, but I'm worried about losing my Medicaid or Medicare, and I need my prescriptions. They cost a lot of money. So we can counsel them around that as well. There are 3 major disability programs, and I kind of named those a little bit earlier. There's Social Security Disability Insurance, also known as SSDI, Supplemental Security Income, as known as SSI, and Childhood Disability Benefits. Social Security calls that CDB, or also can be referred as DAC, Disabled Adult Child Benefits. So we're going to talk a little bit more about what Supplemental Security Income is, SSI. This program pays people who are aged 65 or older, blind or disabled. There's no benefits paid to dependents. Benefits are paid from the general tax fund, not Social Security Trust Fund. There is a maximum federal benefit rate amount. Social Security adjusts that every year at the beginning of the year. There's income and resource limits. And when you're on SSI, it comes with Medicaid, so you're eligible for Medicaid, must live in the United States and also be a US citizen or meet the non-citizen requirements. So the other thing I want to talk about is the definition of disability. And this is the inability to engage in any substantial gainful activity by the reason of any medically determined physical or mental impairments, which has lasted or can be expected to last for at least 12 consecutive months or can be expected to result in death. So typically what happens when a person is applying for Social Security benefits, Social Security is looking to see, you know, is their disability going to last more than 12 months? And so once a person gets awarded disability, Social Security does have everybody kind of on a medical review cycle. So some people will be reviewed medically once a year, once every 3 years, once every 7 years. And those are things that we talk about in our counseling as well with them, when to expect a medical review happening. So also, I wanted to point out a child receiving SSI at the age of 18 will be going through a medical reevaluation under the adult criteria. There is a presentation coming up on October 14th. Margaret Keener will be doing a presentation talking more about age 18 redetermination. So I'm not going to talk too much about that today. So there are some work incentives for folks when they're returning back to work. Social Security has a red book in your handouts. I think I provided a link to that website so you can look at the red book. These are special rules for employment support that help preserve benefit eligibility, including health insurance. These work incentives serve as a safety net while making the transition from benefits to work. And they're available for folks that are an SSDI, CDB, or SSI. So here is the link for you too, if you just wanted to go to the website. Social Security publishes this red book annually. So they're usually behind on getting publications out once a year with the red book. They usually don't get out the current calendar year one until springtime. So now we're going to kind of just jump in here to talk about if a person's on SSI, what types of work incentives are available to them. There's the general exclusion, an earned income exclusion, impaired related work expenses, student earned income exclusion, plan to achieving self-support, also known as PASS, continuation of Medicaid, blind work expenses, and continued payment under a vocational rehabilitation or similar program, Section 301, and expedited reinstatement. And so what I wanted to share with you right here is not all of these work incentives are going to apply to each client that we serve and provide benefits counseling to. We you know, visit with the client to see where they're at, you know, talk about, you know, their work goal, how many hours they're hoping to work, and address, at that time, we talk about the work incentives that are pertinent to their situation. Because if we talked about all these work incentives, they'd be a little bit overwhelmed. It's already hard enough to understand all of this when you're trying to return to work or go to work for the very first time and learn all this stuff about Social Security. It can be confusing. So earlier I talked about the federal benefit amount. So Social Security for 2021, the federal benefit rate amount for an individual is $783, and for a couple, it's $1,175. There are resource limits. An individual can only have $2,000 in resources, a couple $3,000. And one of the things I'd like to share about the resource limits is Social Security has a way to check on people to make sure that they aren't over the resource level. So, you know, a person has to keep track of their bank accounts and make sure they don't go over the resource amount, because that could in turn cancel their check. They could receive a letter saying, oh, we're going to stop your check because you're over the resource limits. And people have the right to appeal that if that were to come up, because sometimes it could be they hadn't paid their bills yet, and that would bring them under those resource limits. And so typically what Social Security does when a person is receiving SSI and they go to work, we advise all of our clients, and we get them the information of, the direct phone number to their local Social Security office. And one of the things I like to share with folks is it's best if a person is returning back to work to always reach out to your local Social Security office and just give them a call. Say, hey, I have a job. I'm going to be working this many hours a week at this rate of pay. So that way Social Security can put in an estimate in the computer. So a person will prevent themselves from getting into any overpayment issues. And so when looking at income, Social Security expects people when they're returning to work to first call and let them know that they've gotten a job and what they hope to be making. And then the next thing is they want folks to send in their verification monthly. And the rule of thumb is the 10th of every month. A person should be sending in their wage income. And, being a person on SSI, there are lots of ways to turn in your wage income. You can mail it into your local office. You can drop it off, but right now the Social Security offices are closed to the public, but they are accepting phone calls from 9 to 4, Monday through Friday. You can report by the telephone. You can download the SSI mobile app, or you can go online now and set up your own My Social Security account at the www.ssa.gov website. Social Security's preferred method for wage reporting now is the online system. One of the things that I tell clients is if they're going to use the online system to report job changes and wages, that they should first reach out to their local Social Security office to let them know they're going to use that system, so Social Security can put in the employer information so they can have access to that system for wage reporting. So back to this general and earned income exclusion, Social Security, when calculating out wages, they give people these exclusions. So the first exclusion is the general income exclusion of $20. This is automatically excluded from unearned income, remainder counted dollar for dollar. And then there's an earned income exclusion of $65. So the first $65 from gross earnings automatically is excluded, counted 1/2 of the remainder. If there is no unearned income, $20 is added to the 65 for a total of 85. So for example, what would be a general income, unearned income? Things like child support payments. Maybe the beneficiaries receiving SSDI or disabled adult child benefits. Those things are counted as the unearned income. So I always tell people too, is if they come into some kind of money and they're on SSI, it's really important to notify Social Security. One of the big questions that comes up is, oh, I'm going to get some inheritance. So with transition age youth, it would be real important to, kind of look at what Enable account can provide to them as well, to help not go over resource limits. So now I'm going to show you an example of SSI and working. So this person's earned income, wages from work. Social Security always looks at gross wages, not net, gross wages. So this person made $361 gross wages. Social Security subtracts out the $20, the general income exclusion, leaving that at $341. And then they take away $65 of earned income exclusion, bringing it down to $276. And then they divide that in half. So in this particular situation, Social Security is only counting $138 of earned income. So then we go back to the federal benefit rate amount. which is $783 this year. And we subtract the $138. So this particular individual's SSI adjusted payment would be $645 a month. So that's what that looks like. But when we're looking at the total monthly income received, we are counting the total gross wages from work, 341, plus the SSI payment, which then gets them up to the $1,006. So in every situation, I always try to emphasize that anybody working, they're always ahead, because if they aren't working, they only get $783 a month. But if they get out there in the work, they're going to increase what they have coming in for income. So the next work incentive I wanted to talk about is impaired related work expenses. This helps a person be able to get more in an SSI check if they're working. If they have items or services because of their disability, so these are things they need in order to go to work. And to use these impaired related work expenses, the individual must be paying them. It can't be reimbursed by another source. And it has to be related to the individual's disability. It must be a reasonable cost and can be excluded from earnings when making a SGA determination. So here are some examples of impaired related work expenses. Attendant care costs, medications prescribed to treat an impairment. I advise a lot of my clients to reach out to their local pharmacy and have them just do a printout of what their co-pays, what they pay per month for the prescriptions. And typically it's good to just maybe get a printout for the past 3 to 6 months to turn into Social Security, so they know that they are paying some out-of-pocket costs for the prescriptions. Medical devices, modifications to a vehicle, residential modifications, service animals, some transportation costs. So some folks will take public transit and they have to pay for that service, or ride a public bus system and they have to buy their bus pass every month. And those costs can be used to help them have more in an SSI check. Work-related assistance devices. Kim, do we have any questions yet in the chat box?
No, we don't, but just a reminder to everyone that if you do have a question that you'd like to ask Tiffany, feel free to type it into the chat box at any time. She's been really gracious about letting us interrupt her anytime a question comes in. So please ask away. Thanks.
Thank you. The next work incentive I want to talk about is student earned income exclusion. This one is a great work incentive for folks in school. Okay, so if you're under the age of 22 and a student who are regularly attend school, Social Security can exclude earnings from employment each month for that individual. I should have changed that. This is the number for 2020. So they will exclude up to $1,900 a month. So if a person's out there working and they're not making more than $1,900 a month in gross wage income, they also are going to receive their full SSI check. So that's the $1,900 plus the $783, which would be $2,683 a month. And so that helps a young person be able to maybe save up, purchase a vehicle, or, pay for some education or whatever they might need to do. And the total annual limit is $7,670. Exclusion is taken before the earned income or general exclusion. So in most situations, a person in school working at the same time, that being in college or high school or homeschooling, they can utilize this benefit. And so a lot of parents don't know that, hey, they're not going to lose their SSI check if they get a job, the youth. So this exclusion is also too, just to put it out there, a lot of Social Security offices locally don't know about the student earned income exclusion. So as it comes up and they want to use this exclusion, we have to call Social Security and make sure that they're have put that exclusion in so they don't reduce their SSI check. So the next work incentive I want to talk about is the Plan for Achieving Self-Support, PASS. This allows a person to set aside income and or resources for a specific employment goal. So it's tied around an employment goal and what are the items that they're needing so they can set aside money to pay for those items. So things like education, vocational training, starting a business, transportation costs, work-related equipment, supported employment. Funds are not counted when determining benefit payment. This one's a little bit harder for folks to kind of jump in and do a pass when they're on SSI, because, you know, what we tell them is they're going to have to set aside wage income to pay for those items. So a lot of people don't really jump at that opportunity too much. A pass plan, more folks will jump into that if they're a concurrent beneficiary, meaning they get SSDI and SSI together. So they have some money to set aside that way.
Tiffany,
So they're all, yes.
Teresa, before you go to the next one,
All right.
can I interject with a question that's come in?
Okay, sounds awesome.
Tiffany, can you share how a student can save without going over the resource limit for SSI?
Okay, read the question again.
Tiffany, can you share how a student can save without going over the resource limit for SSI?
So the one way a student can save without going over the resource limit, earlier I had talked about ABLE account. An ABLE account, you know, a person can Google Montana ABLE account, and that would be a really smart idea to save in a Montana ABLE account, because Social Security excludes that money in an ABLE account. That answer your question?
I hope so. If I hear more on it, I'll bring it to you. I have 2 more questions if you don't mind. Would you like to continue with the questions or go on with your presentation?
I think go ahead with the questions.
Thank you. So the next question is, how does a student notify the Social Security Administration of a student earned income exemption? Do they need to do this in writing?
You know, they can do this in writing, but it would be best, most of the local Social Security offices, they have staff, or they have claims reps that are assigned to their case based on their last name, the first letter of their last name. So they would be assigned to an SSI. I call them case managers, but I don't think they're called case managers. They would be that person that they would report their wage income to. So that would be the person that they would reach out to and say, hey, I want to put in for a student earned income exclusion. What will you need from me to be able to do that? So they would put that in the computer, and it should show up on a report that we use. When we provide benefits counseling to consumers, we use what is called a benefits planning query report, and it's a report that tells us, hey, have they applied this student earned income exclusion or not? And if they did, it'll be on that report. And if we don't see that, then we reach out to the local office to say, hey, we want to use that work incentive. And the nice thing about clients being enrolled in our program, if they're having any difficulty getting some of these work incentives applied to their case, I'm here to help them with that. I can call and make sure that it gets fixed, because sometimes some of the local Social Security offices have new workers and they might not always know how to make that incentive work. So.
And I can attest to how pleasant it is to be able to call you for assistance. But I'm going to go to the next question of, if the person's employment goal doesn't work out, but they still spent money to try and reach it, do they have to repay benefits?
Can you read that question again? Because it was kind of, I'm trying to wrap my head around that one.
This is in relation to a past plan, the
Yeah.
note for a past plan. So if a person's employment goal doesn't work out, but they still spent money to try and reach it, do they have to repay benefits?
You know, if a person's in a past plan, they would be working closely with the past cadre. And if they're not successful in their past plan, they would need to work with the past cadre to figure out what it is they need to do to clear that up. So there might be some money. I mean, because if they want to continue to do a pass down the road, they're going to have to, you know, they can make amendments with the past cadre. They might not have to pay money back. Maybe they're trying to get into a different career. Maybe there's ways to work around that. So it would be a case by case situation on that particular question.
Thank you for taking those questions, and I believe we can move on, Tiffany.
All right, thank you, Teresa. So the next work incentive I want to talk about is blind work expenses. This is available for persons who receive SSI based on blindness. When determining SSI eligibility and payment amount, Social Security does not count any earned income used to meet any expenses needed to earn that income. So some examples of some blind work expenses: service animal costs. So if they have to take their dog to the vet, or, you know, take their dog to the groomer or things like that, those expenses can be used as write-offs to spend down. Transportation costs, federal and state and local income taxes, Social Security taxes, union dues, visual and sensory aids, attendant care costs, and meals at work. So this typically results in a higher payment. This is another great work incentive. It really motivates people that are on SSI to get back to work. It's the continuation of Medicaid. It's called 1619B. And the reason it's called 1619B in the Medicaid system, if a person were to get a letter from the Office of Public Assistance saying, you're no longer eligible for Medicaid, and this has happened more than once in my caseload, for real, you know, I try to explain to clients, if you get any letters from Medicaid or Social Security and you're not understanding, you know, those letters, please call so we can handle that sooner than later. Because lots of these programs, you know, when you're going to appeal a letter saying you no longer are eligible, you have a certain amount of time to respond. And so I have a lot of clients that sometimes they don't like to open their mail, and so it piles up. And then finally, when they want to address it, it could be 3 to 6 months later. And sometimes that's too late to, you know, that's really too late to appeal those letters and say, no, you're in the wrong. I want to have a hearing and say, yeah, I'm still entitled to this Medicaid 1619B. So in the Medicaid system, if a Medicaid worker were to put 1619B in the computer or check eligibility, it allows folks to have free Medicaid while working. So in Montana, the Medicaid threshold amount for 2020 a person can make annually $32,887 a year for 2020, which is $2,739.75. So if a person on SSI was making $2,700 a month, they would still keep their full Medicaid benefits. It would be highly likely they would not be receiving an SSI check because that would be adjusted to zero, and that's okay. They still have their health insurance. And the other cool thing about this 1619B Medicaid is that Social Security sets a new threshold amount annually. So each state has a different threshold amount. And in that Social Security Red Book, all of these work incentives that I'm talking about today are in there if you want to refer back to them after today's presentation. So I think it's a really cool thing, and it's huge for folks, you know, because they're just worried about, how am I supposed to pay for that medication? It costs $500. Well, this Medicaid allows them to be able to go to work and still keep their Medicaid coming.
Tiffany,
So
on
the
the
other,
last one, we have an additional comment, if I could, please.
okay,
Sorry about that. There was just a comment that people can also have an individualized threshold for 1619B.
mhm.
Standard thresholds plus publicly funded medical expenses equals that individual threshold. Thank
Okay.
you.
Yay, all right. So the next work incentive I wanted to talk about is Expedited Reinstatement. It's called EXR. So this one is another good work incentives. If benefits end because of work and earnings, benefits can start again without a new application. Social Security pays provisional temporary benefits up to 6 months while determining if the disability continues. So who would be eligible for this incentive? Folks on SSDI, CDB, SSI, beneficiary who stopped receiving benefits because of earnings from work, is unable to work to or perform substantial gainful activity, is still disabled because of impairments that is the same or related to the impairment. So when a person initially applies for Social Security disability, Social Security will look at all their health impairments, and they'll pick out one that's preventing them from being able to work. And typically folks will have a couple of health impairments on their records. Social Security keeps track of what the final impairment is. We do advise clients, if they're not sure if, you know, their disability is related to you know, diabetes, for instance. You know, they might want to check because they might have listed out a bunch of disability things that they were struggling with. And so Social Security will go back to whatever that initial impairment was to see if they still meet that criteria. And when a person's SSI check is terminated, they have 5 years from the date that their benefits were terminated to request this expedited reinstatement of their benefits. And it's a simple process. All the client would need to do is, if their benefits terminated because of work, and let's say a year into that job, it didn't work out, they were being hopeful, and they just, because of their health issues, they weren't able to continue on with their job. All they have to do is call their local Social Security office and ask for expedited reinstatement paperwork. And it's very important that they ask for it like that, because if they just say, oh, I want to apply for disability, well, somebody might actually do a claim for disability as opposed to this EXR. The EXR, if they request the EXR through their local office, Social Security will send them the paperwork needed. Once the individual finishes the paperwork, and let's say they finish it in September and they turn it back into their local office, Social Security has to expedite that paperwork and put them back in pay status in October. And it's done that quickly. I've helped people through the process a lot. And so they will get their benefits up and going the next month while they're reviewing to see if they still meet the criteria. And it's highly likely that they do. There's not, in all the cases where they've applied for EXR, I think one case in the time I've done this work since 2008 that they were saying, oh, you don't meet the medical criteria. And even that client got a lawyer, and still it turned out he got his disability check turned back on. So here is our contact information. Thomas Sprent is our area work incentive coordinator and past cadre. He's based out of Utah. Also too, you know, when a person's looking at doing a past plan, if they have questions through the application, you know, I can help by reaching out to the past cadre and saying, hey, these are some of our questions. He's very helpful in helping with past plans. And then I provided the national toll-free Social Security hotline. That phone number, they have long wait times. So what I usually try to do is when we're having benefits counseling with new clients is I make sure that they have their local Social Security office telephone number, so that way they can reach out to those folks. Things can get done much quicker by having their local Social Security office phone number. So are there any questions?
So this is Teresa, and so far we've answered questions coming in. Just received one now. Hi, Tiffany. Could you speak about folks also on the Montana 0208 waiver?
Can I have more of what the question is with the 0208 waiver?
Back to resource limits.
The resource limit. So if a person's on SSI, the resource limit is $2,000 for an individual, $3,000 for a couple.
Thank you, Tiffany. See if more comes in. So if you were thinking of a question, please feel free to put it in the chat or the question box, and we'll be sure to ask Tiffany.
Tiffany, while we're waiting to see if other questions come in, this is Kim, and I'm just wondering if, because so often in working with transition age students, what we hear is it's just too scary for them to go to work. It's too risky for them to lose the benefits. Their families depending on the benefits. And I know you've gone through all of the work incentives and explained them to us, but can you kind of share how, if somebody first phones your office and they're saying, hey, you know, my teacher or my independent living center folks that I'm working with, they're really encouraging me to work, but my family's saying I shouldn't because it's going to really affect us in a bad way. Can you go through how you explain this stuff to them in a way that's, because all of the alphabets get a bit overwhelming, all the acronyms and technical information. What do you say to them to put their minds at ease?
You know, what I try to do is a team approach. You know, we want to include everybody that's involved in their transition. You know, if they're in school, we want to make sure that we include the rep payee in the appointments, the local rehab counselor, all their support folks. And, you know, there's a couple of ways that you can refer clients. You know, typically now we want people to call the Ticket to Work helpline if we find that they're eligible. Lots of times getting started, it's nice if they have somebody in common where they can make sure that they get the referral made and moved forward. I was just working with a job connection gal yesterday, and she was wanting to refer a client, or well, she was wanting to refer a client over. And so, you know, Our office is great. I mean, if you feel like the person's not going to be successful at calling the Ticket to Work helpline to refer their own self, you know, we can get you paperwork. We have an intake packet that we can send. My intake specialist really helps them through their questions. We provide follow-up to, you know, every referral that we receive. We send information, and you know, we send out some Social Security release forms, and if we don't hear back from them, we reach out to them and we say, here we are, and we're here to help you with your benefits and your health insurance. And I think once they get to the point where we get all the information and we're ready for the benefits counseling appointment, I think that, you know, really puts families at ease, knowing the information and knowing I'm just a phone call away to help them with that information as questions come up. And so I don't know if did I get to where you were hoping, Kim, or was there more
You
you wanted
did.
me to share with that? Okay.
You did. Thank you, Tiffany.
And this is Teresa. I have one more question that's come in. Do you know if there is a program similar to yours in the state of Wyoming?
There should be, yes. I mean, a person, all you would need to do is go to the Ticket to Work website, and a person can look up WIPA projects, WIPA, which stands for Work Incentives Planning and Assistance Program. Sorry, there's so many acronyms to this Social Security stuff. It gets crazy. But the Ticket to Work website, you can search your other WIPA programs in other states. And that's the other cool thing. You know, if a client is enrolled in our program, and I've had this happen, where they do move to other states, I try to make sure that before they leave our state, because then they're no longer eligible for our services once they move out of our state. I've had clients do that. I had a client move to Alaska. So when she was getting ready to transition and move to Alaska, I gave her the phone number to her local Social Security office, because when she moves to another state, she needs to immediately notify them of her that she lives in that state. I gave her contact information for her local voc rehab office, as well as her WIPA program. So the really cool thing about our program now too is, because we serve Montana and Idaho, we've had clients move back and forth between the two states too. So I didn't get to know about that until we started serving Idaho as well. So I don't know if my coworker in Idaho would think that's fun, because I think sometimes she's gotten some difficult clients.
I'm going to give you one more question. I know we're running low on time, but another has come in. Does Medicaid for workers with disabilities give a person a higher resource limit?
You know, they do, okay? The resource limit for an individual is $15,000. And for a couple, it's 30. And typically with the Medicaid for workers with disabilities, if a person's on SSI and Medicaid, they do not need to go and purchase the Medicaid for workers with disabilities. The other thing that I just now remembered that I needed to talk about is a young person on SSI. You know, when they turn 18, and if they're continuing benefits as an adult, because they'll have that redetermination, it'll take them probably 2 to 3 years to be eligible for their own Social Security disability insurance. So a young person, if they're working right away, they're going to earn their work credits at an accelerated rate. Social Security keeps track of that, and they will take a claim, because SSI is the last payer of resort. Social Security doesn't want to always pay people off trust fund money. If a person earns money on their own work record, then Social Security is going to take that claim to pay them on that benefit. And I just now thought of another case that I worked with. Well, I've worked with a few cases similar. Another thing that can happen to somebody that is receiving SSI is that they might have a parent retire or pass away, and then that client that was receiving SSI is now going to be eligible for childhood disability benefits under a parent record. So those things can happen down the road, and so that's another reason why it's really, really important if a person is receiving Social Security benefits to get referred to our program. So as they receive letters and changes happen throughout the years of working with them, they also too could possibly get other benefits checks being paid to them. I did have one client, which will be very interesting. I was working with Eastern Montana Industries on this particular client, and they couldn't figure out why the individual wasn't getting SSI. They were getting SSDI, but no SSI. You know, and further working with that organization, we discovered, well, I discovered, and I shared with them, that this particular client was receiving 3 different types of Social Security checks. They were getting SSI, childhood disability benefits, and SSDI. So it was very confusing, and all of those benefits checks were paid on a different day. So the bank statement, they were just seeing, they thought just the one check.
Thank you so much, Tiffany. Do you have any final comments before I do our closing remarks?
You know, I don't. Thank you, Kim.
Okay. Well, thank you to all of our audience members today. Please do remember that when you sign out, the short survey will appear on your screen. We do hope that you will take the time to fill that out. Our next webinar, as Tiffany mentioned, is SSI Age 18 Redetermination with Margaret Keener as the presenter. That will be October 14th from 1 o'clock until 2 o'clock Mountain Time. And the registration and flyer for that we hope to have out next week. The recording from today's session will be posted to the training archives pages that I have put into your chat box, and it can take up to 2 weeks for the recording to be posted. Thank you so much, Tiffany, for all of your great information today. Thank you, Teresa, for co-moderating. Thank you for our captioning professional today for your fast fingers. And thank you to all of you who took time out of your afternoon to join us. Have a great rest of your day. Bye-bye.